You're welcome back. This is Newsfile. It's your most authoritative news analysis platform. And here on Newsfile, we put Ghana first. My guest this morning, Dr. Justice Yankson, he's General Secretary, Ghana Medical Association. He's the man who is getting into, at least by the end of the day, I understand, 3 different professions, enviable ones. He's also a lawyer. He was my mate in law school. Kwame Sapong Asiedu is pharmacist and fellow, Ghana Center for Democratic Development, CDD Ghana. Thank you very much, Kwame, for joining us via Zoom from the UK. And as you know, Kwame has been such, helpful from the very starts. Here in the studio again is Martin Pebu. He is a rights activist and a private legal practitioner. Dr. Michael Owusu is virologist, Kumasi Center for Collaborative Research into Tropical Medicine, that's KCCR. And he also is a teacher, Department of Medical Diagnostics of KNUST. He's also a director of the Center for Health System Strengthening in Kumasi. In the second segment, we'll have Professor Ransford Jampo, who is seeking to become the UTAC Secretary at the University of Ghana, also join us. Gentlemen, thank you very much and good morning.
Good morning. Morning.
Right.
Good morning.
Great to have you, Kwame. All right, so let's begin on the note of trying to check what the situation is now in the country. The president is always informed, I suppose, as we have understood over the period. He's told about the science so that he can guide and direct all of us the right path to go, particularly by issuing those EIs, that's laws that will serve us well. So let's listen to the president. What has he been told and what is his concern? Then we'll hear Dr. Patrick Kuma-Abuaji, Director General of the Ghana Health Service, also tell us of the current surge and case counts.
The COVID-19 pandemic is still with us, unfortunately. And this has meant that for the second year running, we are having to hold a subdued Eid celebration. As we continue to count on the grace of God to protect our country from the ravages of the pandemic, like we have done since its outbreak, we can only minimize its health effects and avoid a full-blown third wave if we continue to be responsible and observe the safety and hygiene protocols. The recent increase in the number of infections is a source of worry for me and indeed for all Ghanaians. From the rising numbers, it is safe to conclude that we have let our guard down, and we're beginning to live our lives and conduct our businesses as though we are in normal times.
During our first wave, that was we had last year, we peaked at about 1,100 cases a day. In some days, we were recording about 1,100 cases. There were also several days where we were recording between 600 and 1,000 cases a day. I know we are not there yet, but if we continue business as usual, we'll be heading there. There has been a gradual increase in the cases in the past few weeks. And let me give you an example. If you look at between 11th and 25th of April, we picked up because those were the times that we had relatively low coverage and were not showing. We had in 2 weeks 968 cases. However, in the last, in the 2 weeks, they recorded a 2 weeks period, that's 1st to the 14th of July this year, we have recorded 2,500 cases cumulative. So that tells you that if you look at the period where we were a bit quiet, and now we are virtually doing almost 3 or 4 times the number that we are doing now. So that means that something is not right. I mentioned that some of the key reasons why the threat is there and we are having them is the fact that of the outbreaks in our neighboring countries, they come in and go. The Delta variant circulating in Ghana, particularly in Accra and Kumasi, is a major threat. The Delta variant is not being proved to cause severe disease, but we know that it spreads very fast. And so if, for example, 10% of the people who are going to be very sick, 100 of them will be 10. But because of Delta, we are having 300, then you are looking at 30 cases. And so that makes it a very, very treacherous variant. Part of the protocols that have been designed includes how funerals, etc., should be organized. And just like the protocol, I think it's not being adhered to not just by one group of people, but clearly many people are doing that. We are in discussions coming up with a proposal that limits the spread, that makes it safer, and whilst people still go ahead and have a funeral, we think that it's such a deep cultural thing that it is not something you can just wish away. And so we have a draft protocol that we are sharing to ensure that, how do we ensure that we still have our funerals in safety?
So you heard the President, Nana Addo Dankwa Akufo-Addo, lamenting that we have let down our guard. And if we continue that way, we will be in trouble. That while we continue to count on God to protect us, we should also take some responsibility and do the right things. Then the Ghana Health Service boss, Dr. Patrick Kumar-Boaji, also telling us of the statistics. Let me begin with our guests on Zoom, Dr. Michael Owusu and Dr. Kwame Sapong-Asiedu. So, Dr. Owusu, listening to Dr. Kumar, what would you say are the implications of the current data that he brings to us? And I start with you for a good reason, because we know that all of you who matter in this situation, working to protect us, met in Kumasi and not in Accra, the capital, to look for a way forward. We know also that sometimes Dr. Kumar-Boaji may sound, a bit diplomatic with some of these figures. What do you have to say?
Good evening. Good morning, Samson, and then good morning to your panelists, and then also to all those listening to Joy FM. So indeed, from where I sit, with the data that comes into our center, and having interacted with a number of testing sites also in Ghana and many other places, it's quite clear enough that we seem to be heading towards what we want to call a full-blown third wave. In the early stages, but the cases that are coming fully suggest that we are getting to somewhere that we used not to be. Particularly for us at our testing site, somewhere in June, early part of June, even in May, out of every 100 cases, we normally record about 1 or 2, 2%, both for travelers and also from the community. For the community samples were not coming at all. And then in the early part of June, we started recording 5 out of 100 cases, mostly in travelers. But then the community ones were sometimes 1 or 2. In the second week of June, the percentage increased to about 10% out of every 100. In the third week of June, we were seeing about 20. And currently, for every 100 cases that come from the community, you have about 40 to 50% of them becoming positive as a result of this SARS-CoV-2. So we used not to do that. And we also have a large number of samples coming in from various sites that before then were not coming. So from what the Director of Ghana Health Service said, I will quite agree with him that the data out there fully suggests that things are not going well. And it looks as if we are getting to third wave, for which we have to be very, very careful. And talking about this, I've studied the data from the earlier stages when we had our cases somewhere 12 of March 2020. The average cases was about 50 new cases. That was early part of March 2020. We hit a peak, as he said, about 1,300 on a particular day. That was somewhere in July and August. And then we descended and went to about 50 to 100 somewhere in December 2020. So in January, March of 2021, we went to about 100 cases, and this rose to a peak of 700 new cases on a particular day. That was in March 31, and 31st of March. And then we also went down to about 50 new cases on the average around April 31. So currently, June data was about 50 new cases, and then somewhere in 18th of July, is about 150 new cases. So if you have 497 national data, as we speak now, it clearly tells you that we are heading towards always getting to the peak point. So it will be quite surprising for anybody to think that things are normal. Things are definitely not normal, and the cases are increasing, and it's likely to increase in exponential order as the weeks go by. So the data suggests that things are not going well, and we all have to be very careful and then to adhere to the protocols and do what is right.
Yeah. Kwame, heading towards, we were here in the first wave where we recorded significantly low numbers than we are recording now. How should we, the ordinary people, process this kind of communication in our general alertness to protect ourselves?
Thanks, Samson, and good morning to listeners. I'd want to put what Michael said in context, because he's giving a lot of background data. But we need to also try and map this to the microorganism, the virus we're dealing with. So when it first came into our country in March of 2020, we had predominantly the Wuhan strain and the strain from, Europe and all that. That had a reproductive number from anywhere between 2.4 and 3. Then we had our peak, like he said, and then it started dropping. And then we had a bit of a bulb in October, but it looks like the protocols kicked in again, and it didn't give us another wave. Then in December, we had the other surge, which gave us the bulk of all our mortalities since COVID came to Ghana. That was driven by the alpha strain, or what was called the Kent strain. That had a reproductive number of 4 to 5. Now we are seeing the Delta variant, or the Delta strain, driving globally, and now it's beginning to show up in Ghana, the latest wave. That has a reproductive number of 5 to 8. To put it in context, that is 200 times more lethal than what we got in March by way of contagion. So when I see, and that is why I took my time to give this background. So when I see the president addressing Eid, where he's saying we've dropped our guard, and I look at the crowds, albeit a lot of them were masked, bunched up that way, I look at it and I ask myself, how is the risk communication flowing out? And what are these people supposed to take from the communication we are giving them? Because for all intents and purposes, if they continue to bunch up that way, with a pathogen that has a reproductive number between 5 and 8, there would be significant spread. So what I want people to understand, and how I want the citizens to process this, is you are dealing with an entirely different ballgame. Entirely different from the ballgame we played in March and the ballgame we played in December. If you want to see the ballgame you're dealing with, look at what happened in India between April and June. And look at what's happening in the UK now, where though vaccinations are so high, a lot of new cases are being recorded. Yes, hospitalization is not going up because the cases are being recorded in the segment of the population where they are young and unvaccinated. So it's not a problem. But the cases are going up, which tells you that in the unvaccinated population, when this virus gets in there, it runs amok. So therefore, when you have a country like Ghana, which has just 1.2% vaccinated and almost 98% unvaccinated, you can imagine if we go down this route, the riot that this virus is going to run. And that is how I would want citizens to process the information currently.
Now, I don't need to have understanding of science to appreciate what Dr. Usu and Kwame have just said. And if I come to the fact of the reproductive number of the Delta variant being 5 to 6, and 5 to 8. And
5 to 8.
Yes, 5 to 8. And Kwame says that it's 200 times more lethal than the previous waves by way of contagion. If I look at this information against the fact that in Ghana we have only 1.2% of the population vaccinated, what does that mean?
What it basically means is that if we don't take the steps that will help us break the chain of transmission, we are in for trouble. Basically, that's all it means.
You are in the hospital, you are
Yes.
in the wards. What do you see?
Okay, so I think let me quickly put this in context. I might not be clothed with the powers to pronounce a third wave, but the truth is that we are in the third wave. I don't think we should kid ourselves that, oh, maybe it's about coming in and all that. It is here. We haven't reached the peak, but the wave has started. Let's get it clear. Look, if you look at all the statistics that has been given so far, from Michael's end in terms of the testing, from what Kwame has said, and let me add a bit from the clinical end, you see that the wave is here with us. Let's accept that this is where we are and take the steps that will help us slow down that wave and mitigate our potential losses in terms of deaths and infections and what have you. If you look at one of our foremost places for case management, that's the JIDC. It's now the nerve center for the management of severe to critical cases. In June, they saw only about 8 patients. In July, at the OPD level, they've seen more than 150. At the HDU, ICU levels, they've seen more than 50. The deaths, sometimes, in quotes, we stop counting because we know it will happen. People are dying in transit. If you go to Kolebu, not long ago, the clinics were not seeing cases. Now we are struggling to find ICU places for cases. If you go to Police Hospital, the ICU is full, nearly choked. If you go to Ridge, the same. If you go to Ashanti region, the same. If you go to schools, the spread is there. It's not only in Achimota. In Ashanti region, you have about 4 schools who have actually come into this situation where they are trying to manage their COVID problem. If you go to some of the industrial areas, the mining sites, it is happening. So let's accept the fact that we have a problem on our
If you go to our courts, it is happening.
Yes. So I'm not too sure why we are trying to pretend that the thing is not here. It is here. Let's face it and deal with it head on. For me, that is the key thing. Now, what we have to do under these circumstances, thankfully, we've been there before. But of course, it looks as if we are not learning lessons from what happened to us previously. Because if you look at the approach, government is refusing to enforce, as in the state. You can see the protocols are our best bet for now because as for vaccination, we are on our knees. As of now, 1% of our population will not help us in any way in terms of prevention or mitigating the potential impact of the virus on us. We haven't gotten anywhere close to herd immunity or all the good things we can talk about. So the protocols are our best bet. And at the state level, the enforcement is not happening. Leadership is not setting any good examples for us. if we identify funerals as a key problem, we are still now talking about how to find ways of managing funerals. All this while, we tested this the first wave, we came through the second wave. We are saying that they are super spreader events. Even localities where funerals seem to be, done in grand styles, the problems are there. And at the local level, we are not trying to fix the problems. This pretense or behavior such that we don't want to really touch what has to be touched, I think it is not helping us. The state must show leadership at this point. As for the health professionals, we will do our best. But some of the activities actually go beyond us in terms of what has to be done.
Let me come to Martin and then get you, the professionals to guide us on the path of prevention, as you have done for all this period, more than 1 year, over a period of a year. These doctors have made themselves available to this country and have been doing this pro bono, free of charge. Now, Martin, I've heard people say that, we have seen stadia in Europe. They are packed to capacity. So what are you guys talking about? What's really going on? What they forget is that nobody entered those stadiums if they have not been vaccinated, if they have not shown proof of vaccination, as in double dose, or they have not shown proof of having tested negative. We here want to imitate them. So we invite people into our stadium here in Accra and elsewhere, and they pack the stadium to capacity. Many are not in masks. Nobody is tested. Nobody is checked for anything. You walk around the streets, you see people, they can't be bothered. The trotros are still loading full capacity, and people are sitting in them without masks.
Yeah, it's sad, right, to say the least. So it brings me to one question, that what are we doing about behavioral change? It means we have to ramp up the communication, preaching the message that we should observe the protocols. Yes, that's what we have to do, because you remember last year when the Imposition of Restrictions Act was passed, and it is still law, we're the same people who also railed that if we are not careful with the enforcement, we're going to create a bigger problem. In such situations, they always say that be sure that the cure is not worse than the disease. That's to say, in implementing, trying to stop COVID, you don't create a bigger or a worse problem. Yes, so if I follow the trajectory thus far, I think that in matters like this, it's good Dr. Yankson is here. It's behavioral change that we should ramp up first. We should ramp up that one first, because as soon as you mention that people are not wearing masks, people are masking up in stadia, then the next thing somebody will say that, let the police go arrest all of them. We've advanced all the arguments why at this time it's not the best, okay? So I think we should give ourselves a week or two to ramp up the education, and then we take it from there. Yes.
I get surprised at people who say, because there is selective enforcement of the law, some people get punished for it, some people, nothing happens to them. Yeah. We have people who are standing trial as we speak.
Yes.
They are going to court all the time, yes, wasting their precious, business days, yes, in courtrooms. Yeah. There are people who must show leadership, yeah, from the very top, the president, yeah, who have broken the protocols with impunity. Mm-hmm. I'm surprised at people who look at that and say, why do you expect me to do differently? What would you say to anybody like that?
Yes, it's a difficult problem. Yes, I remember that.
There are those who are even saying that those people, leadership, who must show example, mm-hmm, don't have the moral, grounding.
Yes, to
be able to tell anybody, yes,
to
observe the protocols. Yes. I ask myself, their life, your life.
Yes.
the protection they may have, you may not have.
That's it. That's it. So you're perfectly right. Yes, leadership has lost the moral high ground. Yes, they have. So it still brings me back to the same point that it's not too late to start afresh. And, you know, at the Eid celebration, the president himself said it, that we have let down our guard. So what I'm expecting then is that maybe...
Have you checked how he's been lambasted for saying that he doesn't...
Yes.
He doesn't have the audacity to say that.
Yes, yes. You know, Ghanaians, it's good to see how citizens are engaging on Facebook and other social media, right? That's good. I'm sure the president would also have learned his lesson from it. So perhaps he should come forward with another address to the nation. Let's pledge that we are starting afresh, and seriously so this time, and that will not let down our guard. I think that would help. You know, when citizens are angry, it's good for him to directly also admit his part in all of this, because starting from the Sir John funeral. You remember even before the Sir John funeral, the elections last year.
Yeah.
Yes, it created a lot of problems. We saw that, look, these campaign rallies were super spreader events, but the politicians wouldn't have any of it. So he should come properly, admit his part in all of this, you know, and with that, citizens will be willing to, you know, come on board with him so that we start afresh.
Right.
Yes.
People have even expressed such disgust at the presidential advisor on health, Dr. Nsiah-Sarri, that he didn't see the bad thing he was doing in coming out to communicate to the public that the people who attended Sir John's funeral, nobody has contacted COVID-19. To say that, look, it's fine to go ahead with your funerals and nothing will happen.
Yes, yes, really, yes. That statement was really, really unfortunate. It really was. I mean, at a point I was like, oh, is that from a medical doctor really? And the presidential advisor at that, you know? So I think let's come back to it. Let's come back to it. All of them, they should come forward. Let's admit, look, we failed. We failed to lead you well. We are pledging to start afresh. Support us. Then, of course, let the police also, what they did, you know, at a point, the police would go out and then caution people. You know, they went to Makola, rounded up about 40 traders or so. Some number is a very huge number, and cautioned them. So those would also help. But we shouldn't ramp up prosecutions yet. Otherwise, we'll be creating a worse problem.
The whole municipality, you know, approach was commended to the state, but it doesn't appear that we feel that, you know, sometimes when you do something, it's okay to sit back and to take the feedback and see how it works. Over there, you remember we were talking about it, over there, they had the spot fines. Yes. They take you 10 cedis and then they hand you a number of masks instead of arresting you and taking you away somewhere. And this was working so well. And, you know, it had the people at heart. Here are masks, take them. Just give a 10 cedis as your punishment. You wanted to say something?
You see, I like the angle that Martin came from, the behavioral change. It's a good one. But as human beings, and then knowing the fact that we've gone through a first, second wave, and now we have a third wave, which is being driven by a new variant that is highly virulent. We need a lot more than just the behavioral change. The behavioral change will almost always come from two ends. What you, the individual, decides to do by way of wanting to change your ways. And then the other side is that the recalcitrant ones will have to be compelled one way or the other to conform.
Because they endanger everybody.
That is it. You see, we are in a public health pandemic, and the state cannot renege on their bits and just appeal to people that go and change. No, because clearly the people are not adhering to that message. It's evident. The funerals are happening, the parties are happening, the clubs are ongoing. You walk around and you see it. So the state has to assess the situation we find ourselves in and decide that this is what we are going to do. Right. If there is going to be increased education, it has to be led by the states. Yeah. They will have to provide funding. So, for example, when it comes to risk communication or public education, at this point, we need to have an enhanced form of it. And then beyond that, all the good things that we've spoken about, trying to compel people, but still educating, cajoling them, being caring and all that, so that they appreciate that, look, this is about all of us. We have been spared the first and the second wave, but we cannot continue to pray to God, because the other countries who are suffering, I don't think when they pray to God, God doesn't listen. God created all of us. There are basic scientific principles we need to follow, and we have all of it in our books. We have resource persons, we have people who know what to do. At least, if for nothing at all, during our first and second waves, we practice some of these things. So we should get serious with what we are doing. Beyond the bits that we are discussing now, there are also the issues at the case management, the health facility level, the testing level, and all that. I don't know whether we'll have enough time to go through these things. But ultimately, those bits are not just for the ordinary person. This is a public health pandemic, and the state must lead the way.
Right.
The Ministry of Health has a lot more to do than it is doing now.
I'll get back to you on the questions of testing and contact tracing. But Kwame, what do you say? Look, when I hear you guys explain the issues the way you do, and like you just did a while ago and told us about how this variant, you know, is 2 times more lethal than the 200 times more lethal than the previous, then I'm asking myself, when we got into the second wave, if you have something which is 200 times more than that, and during that, we realized that the handful of ventilators we had, oxygen, were getting into trouble. I have watched what happened in India, and I ask myself, this country, can we afford that kind of situation?
Thanks, Samson. Sometimes I think our behaviors are driven by misconception. And it contributes a lot to what we end up doing. And I'll start from a basic thing. I have begun to have a strong view that even amongst the educated Ghanaians, we do not understand the role of vaccines and how they work. And I'll tell you why. Vaccines work at 2 levels. I'm glad we have Michael here, who's a virologist and doctor here as well. They confer 2 things. There is the personal protection at the individual level, and there's the community protection at the global level. Without the community protection, the personal protection is limited. And that's why we talk about herd immunity. That's the community protection. So if you look at the vaccines, you see that it will tell you, oh, the vaccine is 95% effective at preventing mortality. It's 89% effective against hospitalization. It's 70% against symptomatic disease, and 60 to 70% against infection. These things are measured in communities. I mean, I'm looking at the latest data that has been issued by Public Health England, and those percentages have been measured in communities where herd immunity has been reached. For example, in nursing and residential home workers and residents, who majority of whom 9 in 10 have been vaccinated. And their exposure to the general population, and the advantage that in the UK, you go to every pharmacy and you can pick up a test and you can test yourself, and is encouraged. So they are able to measure accurately the number of people who've actually been vaccinated who have then been exposed to the virus, because once someone gets exposed, anyone who was in their immediate vicinity gets pinged on their mobile phone to say, you have been exposed to this virus and you have to be isolated. And then they go and measure of that person who got infected, how many of his or her contacts actually got infected. So they are able to have this data, and it's quite robust. They are telling you that in a country where herd immunity has almost been reached, still, prevention of symptomatic disease is 60 to 70%, which means 30 to 40% of people who've been vaccinated will get infected and would have symptoms. So when I hear the likes of Dr. Siasari say, oh, no one went to a funeral and got infected, I'm like, what's the science here? Because the data in a country, and you can compare to the data coming out of Clinet in Israel, which is a country that is past herd immunity, tells you that, yes, if you have people with the capability of transmitting the disease, an unvaccinated population. Some who have been vaccinated would get infected, but they wouldn't fall very ill. If they fall very ill, they wouldn't get hospitalized. If they get hospitalized, they wouldn't get critically ill. And if they get critically ill, they wouldn't die. And these are the percentages. And I hear someone who's supposed to communicate the reality to Ghanaians who I believe reads the same data I read, because I know the likes of Michael have seen these documents I'm talking about, and says that no, nobody got infected. Then I ask myself, how do you want the Ghanaian to react to the information you're giving? So I would at this point want to speak to the Ghanaian. If anybody tells you that I'm vaccinated and you are vaccinated and so come for a function and you can ignore the protocols, it's not true. The person wants you to turn into a ghost. You need to be aware of that. Sometimes we need to be blunt. Yes, you have a higher proportion of personal protection, but you have virtually zero community protection. And because your personal protection figures were measured in populations where vaccination coverage is high, your protection might be lower in Ghana because the community protection is not there, because you need A plus B to get C. Your B is 0, your A is there, so your C would be low. It's as simple as that. And that is how something I would want people to take some of this information and behave appropriately. Because if we who read these documents, read them just as documents and come telling people, oh, it's 95% protection against mortality, without letting them understand how these things are measured, and they take it, then you get what is now appearing on social media where you see people, and I'm quite sure a lot of my colleagues have had it as well. Someone say, oh, I got vaccinated, and now I'm being told that I've gotten infected. And they cannot make these correlations. So if we are not careful, then they start spreading another negative narrative around, oh, even if you get vaccinated, you can get it anyway, so why bother? And that will give us problems when we have the vaccine. So we need to expand these conversations. We need to be a bit more contrite with the Ghanaian and level up with them and let them know these things. Thanks, Samson.
Right. Dr. Osu, now in Kumasi, we have been told you this time are taking the lead. Unfortunately, we live in a country where often a lot happens in Accra to the neglect of almost everywhere else. What is happening to ensure that the protection is enhanced for people living in Kumasi?
Yeah, something. So I want to believe that this goes more to the public health division. I mean, we have the regional director of public health and the regional director himself who have been doing a lot, and we've been working with them to at least educate the populace to ensure that information reaches out to as many people as possible. But saying this, I mean, you also know in Ghana, we have the National Strategic COVID-19 Response Plan, which spans from July 2020 to December 2024. And in this 84-page document, every single thing that we need to do at every phase of the pandemic is clearly stated. I mean, you have issues of governance and coordination, you have issues of risk communication and social mobilization, you have containment and case management, you have testing labs, point of entry, research, and all that. When you look at their strategic document, there are aspects on limit and stop importation. There are aspects of slowing down and managing community spread. There are aspects of providing medical care for COVID-19 cases, ensuring government accountability, and minimizing impact of COVID-19 on social and economic life. So with this document, which serves to provide a guide and a direction as to how we respond to this, each of the regions, I mean, both regional directors down to the health facilities are pretty much aware. And I know on their part, I mean, doing whatever they can to ensure that education and all that goes down well to the people. But what I have observed in Kumasi is that, I mean, one, people don't still believe that a virus exists. People think that it's something that has been cooked out there, I mean, for some people to make money out of it. So talk to people on the street and they feel that we should just keep quiet and allow things to go the normal way. And you also know that in Kumasi, issues about funeral is well integrated within our culture. So I mean, you see people at funeral grounds, you tell them to put on their mask, and they just don't want to mind it because they feel that there is nothing called COVID. So it looks as if the kind of fear people had somewhere in March 2020 to December 2020, that kind of fear seemed to be going, and they don't seem to care anymore. And which is why, with what Dr. Yankson said, that if people who are expected to behave in a certain way are not doing that, then it will be very good for us to revisit some of the measures we put in place when we were in the acceleration phase of this pandemic. It may not be very, very good for us as a people, but then I think that we may be able to reduce the number of deaths that may occur. If you look at the data, within the first wave, we had about 335 people who died as of December 31. In the second wave, as of April 31, we have 363 people who have lost their lives. From June 1 to date, we have about 34. And if you have to juxtapose this against the reproductive number of this Delta strain and the fact that it can infect many more people, if we don't do something extra than just looking at behavioral issues, we may likely record some deaths that may be more than what we recorded in the second wave. That is my fear. It looks like the impact is a bit not that strong because most health workers have been vaccinated. Initially, for the first and second wave, as the virus infects, the lab will be infected and then we go to their homes and we deplete the health sector whilst people get more infected. But this time around, it looks as if because many were vaccinated, the health workforce are still on the ground. The soldiers are working to ensure that they contain the pressure as much as they can. But if people are not behaving well and the cases still keep increasing, for how long will you expect them to contain this pressure? And for how long will those testing continue to test? So it looks like if something is not done quickly, we may reach a point where a pressure will mount at these facilities, and as humans as we are, it will be difficult for all of us to contain this. So I agree with Dr. Jansen that we have to encourage people and enhance communication. But then if people out of themselves, for 1 year now, since March 2020, over a year now, we still don't seem to understand what we call the new norm and to live by the new norm, then of course, you will want some form of measures to be put in place to help all of us to live well so that we will be able to protect the vulnerables. Those who will die, reduce the transmission and the risk of infection, and then reduce possible, other children and staff who may lose their lives as a result of this. So I think some form of, some enhanced measures is needed at this point so we can slow the rate of spread and possibly reduce deaths that may occur. If we allow things to go this way, I think that we may run into difficulty.
Thank you very much. Now, Martin, I come back to you to ask a question of law because I'm at a loss as to what is going on. This is the reason I say what I say. At this present moment, funerals, which has come up, as many of you speak, are still banned. People of Ghana, funerals are banned. And as recent as the 30th of June, the president put his hand, 30th June 2021, the president put his hand under another EI, extending that ban. So funerals are banned. Why are they going on and we are complaining that they are giving us a super spreader situations?
Yeah, so...
What's going on? I don't understand. What country is this?
Well, I think that it's because of our past. When I say our past, initially total bans, then 25, the same for churches and all that. So it's apparent that it's almost impossible to return to a situation where you say no funeral at all, you see, because of our context. And we are also saying that, look, we've also seen that this law that gives a minimum of 12,000 and a maximum of 64,000 as fines and then a minimum of 4 years of imprisonment and 10 years, it's too draconian. So part of it, you see how you brought in the whole example. For me, I'll always go back to the behavioral change because the law is said that, no, you will kill more people. You will kill. You remember the day the police even arrested this Fix the Country demonstrators. That day I was studying in court when the police arrested them and put them together in the bucket of the pickup. There was no social distancing. So I was like, you see, you are trying to effect an arrest. You say they are demonstrating, so to speak, without a permit. Then in the process, you put them together in such a way that there's no social distancing. You're going to create a problem.
Please, for the avoidance of doubts,
yes,
I want to read what the present law is. There is imposed by this instrument restrictions on public gatherings. Yeah. Then we felt that by saying public gatherings, we may not have said enough. Yeah. So we should do what? List the public gatherings for your specific attention. Public gatherings, including beaches, festivals, pubs and bars, including hotel bars. Nightclubs are working. Do you know that? Yeah. Weddings, funerals, concert and theatrical performances, parties, cinemas and movie houses, nightclubs, large political gatherings and rallies, large religious gatherings and crusades, pilgrimages, and conventions. All public gatherings set out in paragraph 1.1 are suspended. What don't we attend to? What we just did, the inauguration of the mosque, the Eid al-Adha. What was?
Yeah, so this particular thing, no, you see, this message hasn't gone down well as a total ban. You see the thing, you remember the previous year, the one, not even when I say previous, it's been more than 6 months, that churches should use half of the capacity and all that. That is what has sunk in. So this one has not taken hold as such. Now that we've seen that more people are dying, then it's about time for us to ramp up education on it. But as I've said, look, let's be practical too. In the context now, they will tell you that if we were to go back to the 3 weeks lockdown, we will even create a bigger problem. So it's not easy, I can understand. So that's why
we didn't think when we were making the law, like the health minister, we were not thinking properly when we made the law. And the only thing we exempted was for private burials to have only 25 people. And even that, they must observe the enhanced protocols.
Yes, that is it. Let's do the behavioral change thing. Dr. Yancey is not too pleased, but we will not also say just prosecute. Because
Martin,
12,000 Ghana, even
Martin,
the minimum.
You see, enforcement is not always about prosecutions.
Yes.
You see, what is happening here is that we have a law that the state is refusing to ensure that the law works. Basically, that's what we have. You see, as for the population, we will almost always be happy doing what we think we should do. But the laws of the land, at this point in time, where we have a pandemic on our hand, a public health emergency, allow the state to take certain measures for our collective good. So if the president keeps signing these executive instruments and nobody is out there trying to let it even work, then we have a problem. So if there is good reason in using 25 people or 200 people in a church, so be it. But that ought to be respected.
Yes.
That ought to be enforced.
Yes.
When we begin to do selective activity, where as and when it pleases somebody, we want to go after 1 or 2 persons and leave the rest of the population to do whatever they want, it is wrong. Like Samson said, go to the bus terminals, go to the markets, go everywhere. You can see the problems staring at us. And the cases are going up. We are also in the know of the kind of variant we have. So for me, it is the state that is doing a big disservice to all of us.
But when Martin says that the state cannot be doing all of that and stuff, I don't know which state he's talking about. Because this state has been in court to prevent one group, Fix the Country, from holding a demonstration. When they suspected that they might even breach a court order, what did they do? They took armored cars, several of them, and parked them at vantage places to scare the people, or if the people showed up, they would deal with them. So the state cannot be said not to be incapable of enforcing the law.
No, I'm not saying they can't. I'm just saying that we should be careful because, look, the principle here is that the cure must not be worse than the disease. The cure cannot be worse than the disease. So what are you going to do now? Millions of your populace are not abiding by the protocols. You don't have enough prison cells for them. And even if you did, you will create a bigger problem. You remember the Makola women the police went and rounded up? Those are families, those are breadwinners. So if you took one woman, invariably we are looking at a multiplier effect of about 4 children, and maybe even plus a husband.
That's what Dr. Yangsing is saying.
Yes.
Enforcement is not simply about just arresting people and throwing them in there.
Perfect.
You had mentioned earlier where the police themselves realized that this law is, there was no good thinking into it.
Yes.
So they went out on the street and began rather to educate the people.
Yes. So let's return to it. Let's do it. And you know, even today, the way this atmosphere is a bit charged here, I'm sure the education is sinking in. So we are ramping up the education. Let's continue. After this, let's play it out. Maybe read more of the EI. Tomorrow, let's have more of the education. So keep playing it out. Information services, Kojo upon Kroman's ministry, but they have the information vans, go into the communities. So let's do a lot more of that.
I agree with you. But
Yes.
what we should understand is that at this point, whatever the rest of us here will do together with the media should be complementary to what the state itself is doing.
Yes.
I see your problem. Your problem is this, that the excesses when it comes to enforcement is what we should guard against. And I think that would be good advice.
Okay.
But that does not mean that we should not go on that target, because clearly what is happening is not in our interest. You see, we keep talking about COVID. There's also another problem sitting there, the non-COVID cases and the impact of COVID on their care. It's something that we don't seem to be talking about, but that is also another huge problem. You know, so if we don't take care and we think that we can, you know, be selective in our approach, we can do things anyhow, we will not almost always
let
be
me
lucky.
come in. I think to stem it, remember at a point, government came with Veronica Bakker's other stuff for the schools, right? So we'll call upon government to renew efforts at that. Especially, you see, in the public step down. I think you even narrated some other stories. The people, the hawkers in the streets there. I think there was one you said you asked the guy, and he said, "Oh, master, how much do I earn a day?"
So he got 5 cedis.
And then he was going to buy mask at what price?
But now mask is very affordable.
Yes, but some people will still cry about cost.
Right.
So here to appeal to government to make available more masks, more sanitizers in the public places. Okay, let's increase all of them.
This is exactly what we are saying. That
so let me go to Kwame.
It affects everything.
Let me go to Kwame and Mike for your brief comments again about getting people to become aware that there's a need to protect themselves, to prevent COVID-19 spread. And then we take a quick break, return to look at the probe, where the health minister was grilled to admit that he exercised wrong judgment in the Sputnik V transaction. Yes, so let me start with you, Dr. Usu.
Yes, Samson. So a lot is happening within this time. I mean, June, July, August is also a rainy season. It's quite cold. It's not only SARS-CoV-2, which is causing respiratory disease, but within this time, we also have over 20 respiratory viruses that have the potential of also causing outbreak. One key among them is the H1N1 pandemic influenza virus, which was first detected in 2009. If you'll be aware, I think some schools have recorded an outbreak of this H1N1. The last time we had one in Kumasi Academy, it resulted in close to about 4 deaths. You also be aware that we also have an outbreak of bird flu, the H5N1 in birds, and that virus has the potential of also spilling into human populations and causing some outbreak if not managed very well. So the current season we find ourselves, and the fact that it's raining and people are likely to stay indoors seem to have created a conducive environment for the rapid spread and expansion of SARS-CoV-2 together with many other viruses. And a co-infection with SARS-CoV-2 and any of this could worsen your situation. So we need to appeal to the public that fortunately for us, just the use of a mask can prevent transmission of all these host of viruses. It's not just about SARS-CoV-2, but all other viruses cannot penetrate through the masks that we use, which we put on. So people must understand this and also make this as part of our life. That our lives matter. So if you have your situation like this where you are already at the point where you have many contributing factors that are likely to make you sick, you are better off putting on your mask and using your alcohol sanitizer, observing physical distancing, and then to do what is right. For close to a year, we have all been on this couple of times and so many times. I believe 2-3-year-old children of today know what to do to prevent infection. In as much as we want to look at government to put in measures and then to also do their part, we the people must also do our best to adhere to these protocols because our lives matter. So I think that the behavioral conversation should now be pinned down to we the people, the ordinary citizens, to take this matter up and do what we can, whilst government also looks at ways and means of supporting all of us as a family.
Thank you. Kwame.
And thanks. I was enjoying the banter between Martin and Justice when we read the law. And I would want to ask, I'm not a lawyer, so I would want to ask a question. Who signed those laws? Under whose hand are those laws signed in Ghana? Is it the president?
Yes.
Okay, if it's the president, what business does the president have then attending gatherings that he has banned? That is where the problem starts from. You see, so you tell me to speak to the Ghanaian. How do I speak to the Ghanaian when the person who actually signed to ban actions is attending those actions? And so then I go to Justice and ask, you're calling for prosecution. How do you prosecute somebody who has attended a function for which the person who banned it is in attendance? And so this is why I would veer towards the line of Martin and say, if I was in attendance and you wanted to prosecute me, and I knew the president was there, and I was in court, probably I'd invite the president as a witness. He was there as well. And I've got footage to show it. So to prevent all these things, I'd rather go with Martin's view, even though I would prefer Justice's view of enforcement and say, Ghanaians, your life is in your own hands, like Michael said. You need to protect it judiciously. The community protection is not there. And 98% of you don't have the individual protection anyway. Yes, some of you might have been infected and might have antibodies because of wild exposure. But we know that the wild exposure, antibodies and protection doesn't last as much because it comes from a different part of the virus. Michael is a virologist, he can explain it, but it comes from a different part of the virus than where the actual vaccines elicit your protection. So please, whether the person who signed the law or his acolytes or hangers on are attending functions and inviting you, use your gumptions and advise yourself that your life matters and you are prepared to protect it yourself. Okay. We are not in normal times, and it shouldn't just be the minister saying he acted irrationally in unnormal times. You also have to act in a manner that protects yourself. That's how I'd leave it, Samson.
Thank you also very much. Just some 2 text messages before we go. Dr. Charles Rekubrobe, tweeting at iTarzan, says, who says funerals are banned? when our media is still replete with extravagant funeral announcements, Joker Nation with Dr. Charles Rekruwe, can I say that? Okay, with an ass of a law. And then Kweku Enchibwe Siako says, the irony of contracting a deadly virus at a funeral because our love of funeral is insatiable. Let's call a spade a spade. This is stupidity, period. We'll be right back.